Hello, everybody. Thanks for joining us. We're going to give it a minute, let everybody, all the participants come in, and then we'll get started at about 1 after the hour. Thank you for joining us.
Hi, everyone. I see people are still trickling in, so we have a couple of slides with logistics, so you won't miss anything. Welcome to our annual training webinars. This is our first one in October, and it's called Introduction to CPQCC and Friends. So we will be overviewing our CPQCC program and partners with a special focus on the NICU Data Center. So thank you all for joining us. Next slide. First, we have some webinar logistics. So all attendees will be muted upon entry. Please use the Q&A function and we will do our best to answer your questions during the presentation. And we will also have time allotted at the end for more discussion. We welcome your feedback and recommendations for improving future webinars. We will have a post-webinar survey offered at the end. So thank you in advance for filling that out. Next slide. We will be sharing these slides and webinar recording after the webinar, and they will be posted on our website. If you are currently listening to this webinar in a conference room or in some other team environment, please create a sign-in sheet and send it to contact@stanford.edu to be eligible for our contact hours. These hours are provided through the Mid-Coastal California Perinatal Outreach Program and have been approved for up to 1.5 hours. So to be eligible for these hours, please remain on the webinar the entire time and complete our post-webinar survey. This survey will be available immediately following this webinar, and it is available for everyone, not just those who need the hours. So thank you in advance for filling that out. Next slide. My name is Annalisa Watson. I'm a program manager of the NICU Data Center at CPQCC. In speaker order, I'm joined by Dr. Jochen Profit, our co-chair and co-principal investigator of CPQCC. Next, we have Philani Davis, our NICU Data Center lead program manager, and we also have Courtney Bro, our associate director of quality. Next slide. Okay, this is our agenda. We're ready to get started, so I'll now be passing our webinar to Dr. Profit for an overview of CPQCC mission and key activities. Next slide.
Yeah, thank you, Annalisa. Welcome, everyone. It's a real honor to have a chance to speak with you today and to just thank you for all that you do, because without you, really, there wouldn't be a CPQCC or a CMQCC, because you're really the core of what makes our work. Next slide. Okay, here's our mission. It's to improve the quality and equity of healthcare delivery for California's most vulnerable infants and their families from birth and NICU stay to early childhood. So you'll see that through this mission, we're really including the maternal journey, the neonatal journey, as well as post-discharge journey all the way through high-risk infant follow-up, which ends at 3 years. Next slide. To achieve our mission, really, our organization has kind of 4 key activities. And your work as you know, through the data core are really like so important for really for all of them. But I think I'll touch a little bit on audit and feedback today. Courtney is going to talk a lot about quality improvement. Education is kind of an indirect, maybe there's indirect contribution through our learnings, through your work, and then our learnings from the data to education, but also some research is really, of course, can only be done with the data that you all provide us. So next slide. All right, next slide. Okay, here we are in this, in our quality improvement journey. if you want to improve care or equity for your patients and you don't have data, this is just, where you are. You're in the middle of a lake and it's foggy and you have no idea where the shore is. And so like if you don't know, it's really hard to know where you're going next or click forward. Yeah. And so really the CPQCC report is supposed to be this light tower that kind of shows you the way so that your quality improvement and your equity journey can have some guidance. Next slide. This has been a key slide for us for many, many years throughout the organization. It's one of Jeff Gould's, and I love this slide because it's really about turning data ultimately into action. So again, like what you all do with the data collection, that is a foundation. It's a foundation on all of the things we subsequently do. But we need to, in order to do all the things we subsequently want to do, we need to have high quality and reliable data. And then we take this data and we try to turn this data into information through a variety of statistical methods, but also in terms of visualization and trying to make it as easy as possible with the help of many, many of our providers throughout the states who provide us with over 100 volunteer hours a month to feed the data back in a way that it'll inform providers and to ultimately take action and improve quality of care at the bedside. Next slide. All right. Again, like Courtney will speak a bit about research education in part is what we're doing today. So you'll probably hear more about that. But let me just give you just two examples of the many, many, many examples we have on how your work has influenced research, quality of care, and equity. Next slide. Okay, here's a slide, and like I think the important thing in this is we don't have a video's picture on here. I like to sometimes show those, but like a lot of our work really helps train the next generation. So we really take a lot of care to bring young learners, whether it be nursing students or physician, medical students, fellows, residents, into our work and introduce them to the journey of quality improvement and also research. So here's an example from high-risk infant follow-up, where essentially we found a video PI, let this work on Susan Hinds. I found that actually kind of referral to high-risk infant follow-up for babies throughout the state was highly variable. There were some NICUs hardly ever referred, and infant other NICUs was up to 100%. Overall, as a group, they went up to 83%. And then by going through a quality improvement project and essentially introducing sort of a hard stop for NICUs to conduct a referral, this rate of referral really went to, in the study, to 95%, but more or less we're seeing 99 to 100% referral of these babies now to high-risk infant follow-up. So this is just a wonderful work, and without your contributions, we couldn't do it. Next slide. Here's another example. It was just a hot off the press, which I thought I'd improve it. It's MK Quinn. She's one of our postdocs. So another learner. She was interested in retinopathy trends over time by race, ethnicity, and she's been able to show, again, like through the work that you all do, that overall retinopathy or prematurity rate, even as our babies are getting younger and smaller and sicker, has been decreasing by annually 2%. That doesn't sound like much, but it's over a 10-year period, so a substantial decrease over the time frame. And actually there was also a decrease in disparity. So it's part of like the equity work that's happening, right? So with overall improved care, you're actually doing equity work. So thanks to all of your contributions, we've been able to show this narrowing in the equity gap. And then next slide. And so overall, this is since the inception really of CPQCC, but it's been over 100 quality improvement related publications that came out of CPQCC. And in addition, this work has led to many applications for funding to do quality improvement work. I think Courtney is going to touch on on one of these later. But your work touches essentially all areas of the organization and really helps mothers and infants across the state in a tremendous way. So thank you so much for all of you, and we'll hear more next from Annalisa. Back to you.
Thank you so much, Jochen. Next, we will be talking about our continuum of care structure, starting with CMQCC. We believe that our data at CPQCC and CMQCC encompasses a majority of the perinatal journey, beginning with pregnancy, labor, and delivery through the maternal data center at CMQCC, and we continue to track all NICU admissions on the CPQCC side, with a particular emphasis on higher acuity cases. Our database also includes neonatal transport information and the option to collect data related to maternal substance exposure and other items. Furthermore, we monitor the care provided to these infants as they become eligible for high-risk infant follow-up. Next slide. Oh, next slide again. Sorry, I thought that one was already showing. Thank you. Don't worry, you'll see that one a few times. Okay, so now we're at our numbers by 2023. So to put this data into perspective, let's review our finalized totals from 2023. You all are managing an impressive volume of data each year. Our partners at CMQCC provisionally tracked over 400,000 births. CPQCC recorded about 17,000 higher acuity admissions to the NICU, while the overall NICU admissions totaled to 50,000. CPQCC had 137 member hospitals last year, and CMQCC served around 210 birthing hospitals. The California Perinatal Transport System documented about 5,000 acute neonatal transports, specifically for medical or surgical care at higher level hospitals. And additionally, we have registered approximately 9,000 infants in the high-risk infant follow-up program. So these figures highlight the significant impact and breadth of our work in perinatal and neonatal care. Next slide. We'd like to take a moment to recognize our fantastic teams at CMQCC and CPQCC. So here's a photo of our dedicated group whose expertise and commitment are vital in enhancing maternal and perinatal and neonatal care. Many team members focus on quality improvement initiatives and are experienced clinicians providing valuable insights to this work. And as we move forward, we're adopting a more integrated approach, examining the mother, the birthing person, and the baby together. So thank you all for your dedication and teamwork. Next slide. So we want to take a closer look at CMQCC to provide you all with an overview of our partner organization. The mission of CMQCC is to end preventable morbidity, mortality, and racial disparities in maternity care. Established in 2006, CMQCC operates as a multi-stakeholder collaborative with a strong focus on hospital members. And like CPQCC, they provide essential programs and tools to support hospital quality improvement activities. Their commitment to evidence-based and data-driven QI ensures that their initiatives are effective and impactful, driving improvements in maternity care across the state. Next slide. CMQCC collaborates with a diverse spectrum of stakeholders and active partners, including state agencies, professional groups, community organizations, and key leaders. This collaborative approach ensures a comprehensive effort to improving maternal health outcomes and addressing the unique needs of communities across California. Next slide. So next we can discuss the Maternal Data Center, a key tool developed by CMQCC in 2012. Their primary goal is to support hospital quality improvement, and they leverage existing data sources to provide rapid cycle metrics and performance reporting. Key features include an intuitive interface for easy navigation, alignment of measures for consistent performance reporting, and of course, exceptional customer service to assist their users. So these elements make the Maternal Data Center a vital resource for enhancing the quality of maternity care. Next slide. An exciting update is that the Maternal Data Center is expanding. They primarily serve California, tracking an impressive 99% of the state's delivery volume, but they've also expanded to several other states in the Pacific Northwest, as well as states such as New Mexico and Texas. So we're very excited for them. Their expansion now accounts for approximately 15% of births nationally, which is truly significant. And we believe that this growth enhances their capacity to improve maternal care on a broader scale. Next slide. So we also wanted to show the QI aspect of CMQCC. They have extensive QI collaboratives, and we can't cover them all in detail, but I do want to emphasize that they offer a range of toolkits available for free for users on their website, similar to CP. These resources are designed to support hospitals and healthcare providers in implementing effective quality improvement initiatives. So we're sure your labor and delivery colleagues are well aware of CPQCC, but in the case that they are not, we recommend you connecting with them. Next slide. So finally, a quick look at impact and trends. This figure is taken from the California Department of Public Health's Pregnancy Mortality Surveillance System, and it highlights the trends in maternal mortality ratios, MMR. So while California's MMR reached its lowest point in 2016, it has increased again through 2019, contrasting with a rising national trend. California's pregnancy-related mortality ratio remains significantly lower than the national rate, showcasing the impact of initiatives like those from CPQCC. The statistical significance of these trends emphasizes the importance of ongoing quality improvements in maternal care. So thank you for listening to a quick overview of the CPQCC portfolio. I will now pass the presentation to Philani for an in-depth overview of CPQCC's NICU data center.
Great, thank you, Annalisa. Next slide. So thank you for that nice overview of all the insights and important activities happening with maternal data. Next on our continuum of care structure are the NICU infants, which fall under the CPQCC umbrella. Next slide. Excuse me. But first, we'd like to acknowledge our CPQCC leadership and staff that make this program possible. So I'm sure you recognize a few faces, but there's a few new ones as well. Next slide. Okay, so the CPQCC database has had many developments and milestones since it started in 1997. First, we needed to figure out who was our population, and then we needed to develop eligibility criteria around it. So in partnership with Vermont Oxford Network, we started with Vaughan small babies. We started with that criteria in 1998. And then we expanded to what we call our big baby criteria in 2000. Since then, we've had a few more iterations, but we've always remained focused on the most vulnerable NICU infants, which we refer to as our higher acuity infants. If you'd like to learn more about our current eligibility criteria, you can access it from our main website on cpqcc.org, as shown in the screenshot to the right. Next slide. So we initially started collecting data on paper forms that were scanned into an old computer system. And then we improved our process by developing an online data entry system in 2005, which allowed NICU teams to submit, review, and finalize their data in real time. So this was a game changer for both us and our data contacts. And it also gave us a solid foundation to build on, because since then, we've added NICU transports, electronic data submission to upload batch files, linking NICU data records with HRIF registrations, a separate database to capture infants exposed to maternal substances, and a few other data items that are currently optional. I also wanted to highlight the All NICU Admits database that allows you to collect all NICU infants, including those that don't meet the eligibility criteria. And the initial reason for this database was to meet the needs of teams who wanted to see outcomes from the entire NICU rather than just higher acuity infants. Over time, CCS noticed that the higher acuity infants only accounted for about 30% of the NICU admissions and wanted to better understand the reason behind that other 70%. So since 2022, we've been assisting accredited NICUs to report this valuable data to CCS using the All NICU Admits database. Next slide. Okay, and so the NICU Reports database was also built in 2005. This tool allows NICU teams to review the results of all outcomes and processes that are currently being collected in the NICU database. So over time, you would be able to identify trends, compare your NICU to other NICUs within your region, CCS level, or the overall network. You could then share that information with larger teams to make informed decisions for quality improvement needs, or share your wins on any improvements that you've already made. Okay, next slide. So while we're talking about reports, I wanted to give you some visuals of just a few. When you first log into the NICU report site, the first one you're going to see is this one, the NICU dashboard. And this is a quick snapshot that tells you how your NICU is doing. So you'll see operational information at the top, which include your live births, your NICU admissions and transports. And then further down, you'll see more detail about small babies, big babies, infection control, and how those, and even those babies that were registered and seen in your HRIF clinics. Some of these topics are color coded, as you can see, in either teal, which means that you're doing well in that area, or this reddish orange, which means that there may be opportunities for improvement. If you want to learn a bit more about a specific topic, you can click on the icons in each box to drill down further to see more information. And in the top left corner, you can see a little eye, which explains the purpose of the report. And then next to that, an icon for a video that walks you through the dashboard in more detail. Next slide. And here's just a zoomed in view of each of those boxes and a further breakdown of of either the topic, the different color codes, and the icons that are being displayed. Next slide. Okay, so next we have our health equity dashboard that shows you the race and ethnicity distribution of your patient population. At the top right, you can choose specific time periods. In this case, we're using 2020 to 2024. Each box represents a specific outcome or process measure. For example, if we look at human milk nutrition, we can quickly see that about 50% of our Black infants received human milk nutrition. And if you hover over that bar with your mouse, you can see the pop-up that shows the numerator and denominator, which tells us that out of 16 Black infants that we have in our population, 8 received human milk nutrition, which makes up that 50%. And if you click on the Show Details link within the box, you'll see a slightly different format for the same data. Next slide. So after clicking on that Details link, you're going to see one of two versions of this report. The one that you're looking at now is version 1, which gives you a pie chart that shows you pretty much the same info in a slightly different format, which is a bit smaller than what you would see in version 2. Next slide. So version 2 is what you'll see if you have a wider variety in your race and ethnicity population. To get to this screen, you would need to click the toggle dash icon that's where you see the arrow, and that'll change the cards a little bit and give you those bars that you see on the right side of that pie chart. You'll also have the option of reviewing this data by region, by network, and by CCS level. For this demo, I had to switch to region to give you an example of a larger distribution since our demo NICU is very small. But like the previous report, you'll see the icons at the top left to find more detailed information and a video as well, which you'll see for pretty much most of the reports on the website. Next slide. Next, we have what we call our SPC, or what we call our control charts. These reports display trends in NICU volume measures, processes, and outcomes. They're great for tracking your QI work and determining whether the changes you see are significant or not. You can also set your own custom QI periods where you can establish a baseline and even a sustainability phase. When you hover over any of the dots that represent a specific time period, you're able to gain more detailed information about your percentages and the volume of the measure that you're looking at. In this case, we're looking at human milk nutrition, which is pretty much the theme here. Next slide. Next is what we call our NICU baby monitor, which is designed to give you a composite look at your process and outcome measures for your NICU overall. It's in the form of a spider plot and gives you 9 identified measures to represent the quality of care for very low birth weight infants. The further out your points are, the better you're doing compared to the network. And you can click on any of these measures to see its individual percentile score. For instance, again, human milk, we see a score of 68. Next slide. Okay, now I want to share some of our focus board reports with you. This is one that this one shows the homepage of the all NICU admits data, which includes the population of all infants that were admitted to your NICU. At the very top, you can see the total number of your NICU admissions, followed by the top 3 problems during NICU stay. And if you click on any of those go buttons below it, it'll take you to a different feature of this report based on its description. Next slide. The next focus board is for those of you who participate in collecting data on family-centered care, which involves the following 3 measures: priming with oral colostrum, skin to skin, and social worker visit. Notice that the homepage is much like the ANAD, the All NICU Admits dashboard, and gives you a quick glance at the percentages for each measure. At the top right, you can use the drop-down link to do a deep dive into any of these measures, and it'll give you a different feature of this same report. Next slide. All right, so the last focus board I want to share is the one for the chronic lung disease. We noticed that a lot of our NICU report users had a high interest in this area. So this board was really created to satisfy that need. It brings together CLD rates as well as practices for preventing or treating CLD. So we hope that you'll use this focus board in evaluating your efforts to change practices over time and the outcome of CLD over time. Next slide. All right, so you probably get it. We've got a lot of reports, and that's mainly because we've got a lot of data. And we want you to see the fruits of your labor and benefit from it through quality improvement. But the best way to learn about all these reports is by visiting the homepage of our NICU Reports website, which is the screen that you see here. On this page, you can click on any of those buttons at the top, and it will give you detailed information on each report listed. So we encourage you to visit this page at least once when you're logging into NICU Reports. Next slide. Okay, so now that you've seen some of examples of our reports, I wanted to give you a quick visual to help you understand how this all works. This is a high-level breakdown of the data flow, and similar to what Jochen mentioned earlier about turning data into action. Our data abstractors are the starting and most important piece because they submit the data they submit the data into our NICU database. Then we work with them on the front end through customer service, technical support, and other tools for data cleaning, while our biostats further analyze and prepare the data on the back end. So this entire process produces high quality data for reports, your internal QI projects, any QI collaboratives that you join, and research. Next slide. And here's just a snapshot of what our CPQCC membership looks like. We currently have about 80% of the NICUs in California participating in CPQCC. And you can see the breakdown of that both by CCS level and by perinatal region. Next slide. So some of the resources that we offer to our NICUs are highlighted here, the most important being our help desk, because this is usually where communication with us starts. And it's what you'll use to submit any questions or concerns regarding data entry, reports, eligibility, or just general questions about the CPQCC program as a whole. Outside of the help desk, we offer other types of resources, such as one-on-one support, webinars like the one you're attending today, data applications that enhance and improve the process of your data entry, your data tracking, and your data reporting. Next slide. We also have committees and work groups that some of you are already participating in. Our Data Committee Advisory Group is a team of experts that help us to optimize the data entry process And our mentorship program are your peers who help you use our tools to better manage your internal workflow. And then we have our other resources to help you track your data, to assist with meeting deadlines, and more importantly, those award certificates to recognize all your hard work that you've put in and the value that you've added to CPQCC overall. So thank you. And with that, I'll pass it back to Annalisa to talk more about NICU transports.
Thank you, Fulani. Next slide. So back to our continuum of care structure, we have our neonatal transport data. Next slide. The state of California mandates the California Perinatal Transport System to streamline perinatal transports and track bed availability for neonatal and high-risk maternal care, promoting effective perinatal regionalization. This process is supported by the perinatal.org website, which offers 24/7 bed availability and facility contact information. CPETS operates across 2 regions, North and South, and includes a data system with standardized reports to inform quality improvement initiatives. Next slide. Data collection for CPETS began in 2007, averaging over 5,000 records per year over the last 5 years. This data is collected in the field using the CPETS Acute Interfacility Transport Form, which is then entered into the CPQCC Higher Acuity database using the CPETS form. Each year, standardized reports are generated and provided to facilities to support your quality improvement efforts. Next slide. There are key challenges in perinatal transport, including underutilization, delays, and time intervals in the transport process. Our data collection and reports aims to answer critical questions such as, are we effectively transporting mothers to risk-appropriate facilities before delivery? How timely is our transport process from decision to arrival at the receiving facility? And how does the infant's condition change throughout the transport? Teams can access this vital information in the NICU reports database. If your NICU engages in acute transport, we highly encourage you to listen to our CPETS webinar, which is next Wednesday at this time, for more information and for reporting of key trends. Next slide. Now we wanted to give a brief highlight to our partner, RPPC. Next slide, please. The Regional Perinatal Programs of California, or RPPC, is a cornerstone of California's community-based perinatal health system. This system includes the Comprehensive Perinatal Services Program, RPPC, and local Title 19 efforts. Together, they support prenatal, delivery, postpartum, neonatal, and infant care services, which have proven effective in reducing maternal and infant mortality and morbidity. RPPC was established in 1979 to address the needs for a coordinated, cooperative network of public and private healthcare providers, and by fostering collaborations with specific regions, RPPC ensures pregnant women and their babies receive appropriate, high-quality care. And over time, it has also become a resource for quality improvement, offering consultation and technical assistance to hospitals and healthcare providers. Next slide. And RPPC and CPQCC collaborate to improve maternal and neonatal health statewide by creating integrated, high-quality care systems for mothers and newborns. Key objectives of this collaboration beyond integrated care systems include quality improvement initiatives, stakeholder engagement, and holistic support. Next slide. Okay, last on our continuum of care structure, we have the high-risk infant follow-up group, or HRIF. So this reporting system is in partnership with California Children's Services, also known as CCS, and they oversee outpatient follow-up of infants requiring additional developmental care after NICU discharge. HRIF clinics provide follow-up care to all infants born before 32 weeks of gestation or with a birth weight less than 1,500 grams, as well as infants with a range of neurologic and cardiovascular risk factors. Next slide. There are currently 66 high-risk infant follow-up clinics across California, along with 12 satellite clinics. These clinics play a crucial role in providing ongoing care and support to high-risk infants. By offering specialized follow-up services, these clinics ensure that infants receive the necessary assessments and interventions to promote their healthy development. The satellite clinics extend this vital support to more remote areas, making it easier for families to access essential healthcare services for their children. Next slide. Each infant is provided with 3 standard core visits, and in addition to these core visits, CCS may cover additional visits if deemed necessary by the HRIF team. So this approach ensures that each infant receives the appropriate level of care based on their individual needs. Next slide. HRIF visits go beyond neurodevelopment assessments and consider hospitalizations, surgeries, and medications. They also track data on infants receiving medical and special services and any gaps related to these. Key programs like Early Start and the medical therapy program support these efforts, while they also address parent concerns regarding various social factors. Next slide, please. The HRIF reporting system also includes a clinic dashboard. This dashboard assists clinic sites with patient management and tracking, enhancing timely follow-up and data submission. So by streamlining these processes, we can improve the overall care and support provided to high-risk infants and their families. Next slide. This is the HRIF Health Equity Dashboard, which provides a view of site-specific outcomes based on social factors like race, ethnicity, primary language, and medical coverage. So by examining data through various visualizations, we can assess whether there are differences in outcomes among different patient groups. And the goal is to identify any disparities and track if these factors are improving over time, ensuring that we are advancing equity in patient care. Next slide, please. So NICU teams can request access to the HRIF reporting system to streamline patient referrals and to access NICU summaries and reports. So to get started, you can submit a help desk ticket at cpqcchelp.org. And also stay tuned for the upcoming CCS NICU referral dashboard, which will further enhance this process. Lastly, for more information about HRIF, please join us at our final data training webinar, which is Wednesday, October 30th for Erica Gray and Dr. Susan Hintz's presentation, What's New with HRIF. Next slide. Okay, so as we've just reviewed, we have a lot of programs, as Falani mentioned, as we've reviewed, we do collect a lot of data, and you may be asking, does this make a difference? Next slide, please. So if you've been involved with CPQCC for a while, this picture may be very familiar to you. It was on our website for a long time, and this graphic was generated back in 2008, and it shows that yes, this work has made a difference in improving neonatal mortality and morbidity. Next slide. We've been running these numbers again and again. So 10 years later, from 2008 to 2017, our analysis shows additional improvement, including additional reduced mortality rates by 15%, an additional 9% of babies discharged without major morbidities, and the rate of NEC decreasing by 45%, among other achievements. Next slide. And now we have more updated numbers. So this analysis was from 2014 to 2023. Our improvements are less substantial, but there are noticeable reductions, including a 13% decrease in severe intraventricular hemorrhage, an 8% reduction in neonatal mortality, and a 6% decrease in ROP. Next slide, please. So some of our outcomes that we've evaluated more recently have increased or plateaued, which may indicate we're at the edge of our technology or that more creative improvement strategies are needed. Hospital-associated infection is an example of this. It's been fluctuating up and down since 2014. So since then, there has been an 11% increase, but it hasn't been steady. It's just been up and down and fluctuating. So we wanted to share a few plateaus with you, and it only seems appropriate to pass this conversation along to our Associate Director of Quality, Courtney Bro, to share more information about all the innovation happening at CPQCC's quality improvement area, their activities and their impact. Thank you, Courtney.
Thank you, Annalisa and Fulani. We'll go to our next slide, Marcy. Thank you. Welcome, everybody. I'm so glad to be here today with you all. And just a big kudos to our data center team. Annalisa and Fulani, thank you for your partnership and your teamwork around this. And I know that many of you in the NICUs have personal experiences with both of them. So just, I know how special they are. And I just want to acknowledge their amazing dedication to this data. So you've heard this. We want to spread quality improvement throughout California. We want to turn data into action. So I am here as the Associate Director of Quality for over 20 years with CPQCC to kind of highlight some things with you today. So thank you. Next slide. It's really important that QI work is designed without any QI work that's not designed without an intentional focus on equity can really mitigate, worsen, or perpetuate existing disparities. So at CPQCC, we want to enforce this equity-focused QI, quality improvement. And this framework really intentionally integrates equity through all of our quality improvement projects to address the needs of disadvantaged populations. And really, this approach can effectively combat disparities. And we do that in these 4 different areas: in quality improvement, throughout education, our improvement palooza, our data feedback, of course, from our data team, and then our partnerships throughout the state. Next slide, please. So you saw a slide earlier about our partners. This is always evolving, and there are never enough partners to make a difference for our moms and babies throughout the state. Over to the right, you can, well, we've already talked about CMQCC at the top, our amazing sister organization, but our PQIP volunteers is what I really want to highlight now. That's our perinatal quality improvement panel. And this is a group of volunteers that contribute over 100 hours monthly. These volunteers drive our work throughout the state. And these are experts from many of your NICUs that guide in our framework and our quality improvement initiatives, including our collaboratives. We have our Family Advisory Council at CPQCC, and their primary goal is really to shape systems of care throughout the NICUs to improve infant outcomes while centering that family voice. We, of course, work with California Association of Neonatologists, the Vermont Oxford Network, our key partners at the state of California, and community stakeholders. These are community-based programs that are aimed at educating and supporting our families, and particularly in marginalized communities. We need to ensure that our families have the access to resources and services for the best outcomes of their babies. So this is not exhaustive, and we, of course, have room for improvement here to expand, but just wanted to highlight some of our key partners. Next slide, please. So really, I'm going to focus in a little bit more on our perinatal quality improvement panel. And within this panel, you can see in the central location in green, there are spokes coming out with different areas, and these different areas are subcommittees. On the left, the purple circles are really our subcommittees that focus on 4 key areas: education and outreach. And we really look at our, this subcommittee runs our Improvement Palooza yearly. Our QI infrastructure subcommittee focuses on the revision and review and even production of new toolkits. Our PRC research committee really looks at publications. They look at coming out of our collaborative work. They also look at QI research in various areas. And then, of course, our data with our data integration and opportunities committee, which really aligns nicely with our data center and looking at ways that we can streamline and present our data in the best way that we can so that you can use it in the best way that you can. And then to the right are our health equity subcommittees. We have the Within the NICU subcommittee, which is really looking at tools like the NELP toolkit that was developed over the last year to be able to provide tools for our NICUs in an equitable way. Our safety net NICUs, we'll talk a little bit more about what we're working with around them, a subpopulation of our NICUs in California. And then, of course, you heard a little bit about the HRIF transition to home, but that's all around health equity as well. Next slide, please. So looking at our structure for our perinatal improvement panel, you can see all of those committees that I just spoke about in the second level there. And then again, what their responsibilities and their goals are on a yearly basis. They report up to this perinatal quality improvement panel. There are 12 meetings a year. So these folks are busy. Next slide, please. And you can see the expansive network that we have of these PQIP members. So currently, these are our PQIP members. We have 25 of them that, again, represent different NICUs throughout the state, and they are the voices of your NICUs in guiding this QI work. It is invaluable. And you can just see the geographic representation on the left with the map to see where they are located. Next slide. And we welcome you. I'll do a little pitch at the end, but if you'd like to get involved and be a voice from your NICU, please contact me. We'd love to have you get involved. So how do we do this with equity-focused QI? There are many ways that we disseminate this to you as NICUs. And I'm going to highlight one of them, which is our Improvement Palooza. Next slide, please. So through the years, Improvement Palooza concept was born in 2020, where we focused through the years since 2020, we're coming up on 5 years next year, we really focus on these key themes around disparities in care, family-centered approaches, and social determinants of health. So we have consistently, as you've seen right here with this graphic, we've incorporated sessions around health equity, racial inequities in neonatal care. We've brought in speakers and have had workshops that have emphasized the need to understand and address unequal care, access to care, and also the difference in health outcomes for marginalized populations, particularly focusing on preterm infants and their families. We have a data-driven approach to equity. We encourage, as you have just seen from Annalisa and Fulani, to really utilize that health equity dashboard so that you can understand more deeply where there are opportunities for you to act and identify disparities, and then implement these targeted QI interventions. So our Improvement Palooza highlights that. We've had sessions in the past, and we will continue to really identify these gaps in care, develop strategies to close these gaps, and then monitor this progress over time and sustain these practices. So we really hope to empower NICUs to drive equity through measurable actions. We have our QI collaborative. Our projects have an equity lens. So we help facilitate this at our yearly quality or our yearly Improvement Paloozas, where we really look at these projects and we bring NICUs together, right? To be able to focus together collectively on reducing disparities in care and really tackling infant mortality, looking at improving outcomes for infants born in low resource settings. These are all key items that we address in Improvement Palooza. So as you can see through the years, we have this evolution, but really what we are drilling in are these concrete approaches to reduce disparities. Next slide, please. So with that, I am so excited to highlight our upcoming Improvement Palooza, which is on Wednesday, March 5th in San Diego. It's a new venue. We are no longer on Coronado Island, but we're at a new location, which is the Catamaran Resort Hotel and Spa in San Diego. The QR code is there to register, and really our overall arching theme is navigating neonatal QI back to the basics and forward with equity. We hope that you and your team attend and join us. And we really hope to bring teams together, as we do every year, to network, to learn from each other, and then hear from our experts at the podium on how to move forward with equity. Next slide, please. So I'm going to shift a little bit and talk about our QI collaboratives, which is something that I really need to acknowledge all of you as teams that have participated in these QI collaboratives. You are the bread and butter of our organization. You make the wheels turn. And with these QI collaboratives, next slide, you can see for now over 16 years, we have been improving collectively together. A whopping 75% of CPQCC NICUs have participated in one of these collaboratives over the past 15 to 16 years. This is really exciting. And I'm just going to give a couple key updates around where we're at with several of these collaboratives that have closed out in the last year. Next slide, please. So with that, next slide, please. I'm really pleased to highlight our GAIN collaboratives. And these were our growth advancement in the NICU collaboratives. We had a cohort for our surgical patients, and then we had another cohort with our 10.9, our small NICUs, those with an average daily census of less than 10. Or I'm sorry, less than 11, 10.9. So if we shift up to the first set of circles here with our surgical patients, you can see the outcome metrics here. We were able to stabilize the percentage of growth restricted infants. Our process metrics included significantly improving adherence to TPN optimization and standardization, surgical feeding guidelines, and then increase the frequency of nutrition rounds. So those were great processes that helped overall with the nutrition of these surgical patients. And then our balancing metrics remained the rates of NEC and the low sodium bicarbonate, feeding intolerance, and discharge on breast milk, and high growth velocity. All of those metrics remain stable, which is good. Shifting down to the lower set of circles, you can see with our 10.9 NICUs, our smaller NICUs, they had fewer infants that were growth restricted at discharge. Our process metrics included earlier initiation of skin-to-skin contact, which is just beautiful and amazing. And we also had a significant increase in the percentage of infants with completed nutrition rounds and feeding protocols adhered to. So these were new processes implemented by these NICUs. And then, of course, our rates of NEC remained stable as our balancing metric. So just a congratulations and kudos to our NICU teams that participated in both of these QI collaboratives. And a big thanks to our leaders. Dr. Irfan Ahmad led the surgical patients collaborative. And then Dr. Lupe Padilla led the 10.9 collaborative. So congratulations to all. Next slide. And this is hot off the press. Our NICUs enabling optimal brain health, our NeoBrain collaborative just wrapped up over the summer with their sustainability phase. And so we started in May of 2022, and there were 26 teams that participated in this. And as you can see, with their outcome metrics, they achieved 100% of parents report care competence at discharge. We had a parental survey that was a first for this collaborative. We also had a parent lead on required for every one of these NICU teams. So this was another first for this collaborative. So really evolving with our family-centered care and prioritizing and focusing on that parental voice was key. With regards to our process metrics, they significantly increased positive care team touch. And those are little hand hugs, right? So you think of those, your NICU patients that aren't able to do skin to skin, or they're too unstable to be transferred. Hand hugs, we started tracking that, and it was a beautiful opportunity to see the impact on these little infants, but also with their families. More infants were receiving skin to skin within the first week of life, another huge win. And then decreased time to their first skin to skin encounter. We saw some data around that, which was great. And then with the balancing metric, there were stable rates of IVH. So really the overall themes with this collaborative was, again, elevating that parent voice and the experience, sustaining these successes. We administered a culture survey looking at the culture of the NICU, and then vignettes where we drill down on provider variation. We'll be releasing that in the next 6 months to kind of look and see how we can do better around that, but kind of keep our teams engaged still around quality improvement concepts like vignettes. Okay, next slide, Marcy. Thank you. So next update is around our newer collaborative. This is our Moms Collaborative, motivating and optimizing maternal milk in safety net NICUs. Next slide. This is our amazing and diverse representation from our safety net NICUs panel, Moms panel, with expertise varying from lactation, meeting families where they are. So we have family representation here. We've got our internal team with our biostats and our data team, but you'll recognize a lot of these faces. Dr. Kerlin Payton is our co-director of this collaborative. And then we even have our friend out in Boston, Dr. Meg Parker, that is a part of this, from all of, leveraging the work that she's already done and learning from her. So just want to highlight a community partner, Ruta, on the top left. We have this vast experience that we bring together on a monthly basis to guide our teams. Next slide. So we have 26 safety net NICUs that are a part of this collaborative. We kicked off in June of 2024. And these are some of the highlights from our first learning session. We met at Santa Clara Valley, and we really focused on empowering mothers and looking at that autonomous decision-making and a supportive environment, and really ensuring that mothers are part of this change. This is key. This is also an important aspect of this was community and action. You can see that number 1 there. We had teams actively sharing, discussing the use of utilizing lactation educators to improve outcomes, and then also looking at how we can provide education, not only to our families, but our staff around the critical importance of human milk and the feeding resources. The graph here on the lower right, I'm going to shift to that, is any human milk. It's kind of tiny, sorry about that, but it's any human milk at discharge. So the lower line is where I want you to focus on for a moment with the open circles. Those are our safety net NICUs. And look at the rates differing from the line above them, which are all of our NICUs. There are huge opportunities here for improvement in this area with human milk at discharge with our safety net NICUs. And this is what drove this opportunity for us to conduct this QI collaborative. Big thanks to Dr. Jochen Profit for securing an R01 around this so that we have funding available for these safety net NICUs that typically don't have the financial resources, the staffing resources to be able to participate in QI work or in our formal QI collaboratives. So we are engaging these teams and meeting them where they're at. And it's just a great opportunity for us to move the needle here. We can do better, and we're supporting these teams in a really unique way and really creating a landscape of breastfeeding support and access to breast milk. That's our goal here. Next slide, please. And really excited to kind of highlight our new upcoming QI collaborative, which we've coined Collaborating for Access and Resources in Early Care, or in Early Life, the CARE Collaborative. And this will be focusing on the social determinants of health with throughout the state for all of our NICUs in California. Next slide, please. So we'll be kicking this off probably like in the fall of 2025. There's a lot of planning that has already gone underway, but really addressing unmet health-related social needs is a priority for us at CPQCC. So we've outlined some of the steps in terms of we would like to identify a screening tool. So decrease our variation in how this happens. Identify a process for a partnership with community partners, right? All of our NICU babies come from somewhere and they go home somewhere. So let's set them up for success. And then our third step is really integrating the SDOH screening and referrals into the NICU workflow, which we've learned from a lot of our collaboratives that hardwiring these practices means success for these babies. So as always, we will have a faculty panel, and we're in the process of forming that right now. We will create a SMART aim with the panel, looking at our metrics. What kind of outcome process and balancing metrics are we going to select? Our site selection. This will be available for all NICUs, including safety net NICUs. We will be leveraging existing resources within our sister organization, CPQCC, our Health Equity Task Force, and the Safety Net Subcommittee there. Dr. Parker's team. We've been utilizing a lot of interactive tools. If you know of new ones, let us know. But we've really been doing a good job with Padlet as a interactive resource. Another way that we're kind of pivoting with tools is REDCap. We no longer have our extranets. For those of you that used to be a part of our collaboratives within the last 16 years, we've evolved. We've evolved with time. We've evolved with technology. And then looking at our family advisory group and having them be really a part of this and also a lot of our community-based organizations too, and tapping into them. That is going to be key. And I think really a key outcome of this is to develop this resource directory. That will be very different if you're from a NICU in the South or in the North. We're going to figure this out together with you and march through all of this with you. And then, of course, to have that connection with HRIF, that is key. Next slide. So our proposed framework includes this local implementation at each and every NICU that will be a part of this. So family voice, we've already realized how critical that is, and that will continue on with this collaborative. We'll have multidisciplinary staff as part of your local QI team. That is nothing new. We will then look at screening tools and really select, and then all of our team should be adapting that as appropriate to their own NICU. Again, this resource guide development. And then we start our PDSA cycles, right? Our plan, do, study, and act. And we really want to integrate that practice. We want to hardwire that practice into the NICU workflow. We want to increase the quality of those referrals. We're going to need touch points to these referrals that are happening from the NICU into the community. And then, of course, improve those connections with these resources. Next slide. So here's our timeline that we are proposing. And as you can see, we have been busy. We are starting to form the faculty panel and our advisory panel as well. We will move forward again with the framework of our QI collaboratives, the aim, the metrics, the potentially better practices. All of that is a group process, and then our teams will engage with them around their thoughts around this too. We conduct a context and process survey, so we have a better understanding of where we're at with our NICUs that will be participating in this collaborative, and it is geared and framed and tweaked for them. We are actively looking at grant opportunities. This is something that we want all NICUs to take part in. So we are trying to do our best to be able to provide an opportunity for all to be able to do this. So we hope to open registration up next March and really start recruiting. We would love to have your team join us. Any questions, feel free to reach out to me. And we'll start with our faculty and advisory panel meetings. So our groups are always busy behind the scenes, at least 6 to 8 months ahead of the launch of our collaborative. And then there we are. Our tentative launch is September of next year. Next slide. So just highlighting some QI opportunities for you. Well, Improvement Palooza, I saw Annalisa, thank you for putting the registration link in the chat. Hopefully we see you there on March 5th, new location. And that's on a Wednesday. So that's a new kind of shake up with the dates too. Typically we're on a Friday and then CAN follows us on Saturday and Sunday. Well, this year we're on a Wednesday. We're shaking things up. So hopefully you can join us on Wednesday and then stay to enjoy CAN, which will be on Thursday and Friday. The next opportunity is our CARE collaborative coming up. As I mentioned, all CPQCC NICUs are welcome to join. We'll be launching that. And again, registration will open in March of next year. And then connect with us. You want to get involved in a PQIP subcommittee? We have interest groups that are forming right now. We have an SPC interest group. So if you guys want to get involved, we are ready. We are ready for you, and we can't wait to work with you and partner with you in this way. And let us know what we can do for you. Just, let us know. So really, next slide is, I think, in terms of a statewide effort here, we want neonatal excellence. And so we all are on this journey towards quality. We want 100% participation from all of our NICUs. It's going to look different in each and every single NICU. We know that you have a unique station and you're all on the road to better care. And really, quality improvement is going to take us all there together. So from data to impact, that's where we're at. We want to be able to create these touch points, whether it's a QI collaborative, this webinar today, an opportunity to utilize one of our tip sheets. We want to make sure that we demonstrate that there's clear connections between our quality metrics, our NICU practices, and positive outcomes. So let's go. We want to make sure that, again, utilize our tools on our website, our toolkits, our tip sheets, there's guides, there's checklists. and even maybe some motivational items that you'll see at IP25. But we're ready to be able to set off with you in the deep, fun world of quality improvement. And let us know if you have any questions. I'm always here for you. Next slide. And we really would love to have you join us. So by doing that, you really help shape the future of neonatal care. And that always happens with innovative ideas, creativity, and then a collaboration. And I just want to highlight, this is our PQIP group here on the top. Our staff is on the bottom. I know you've already seen them, but get involved, join a subcommittee, use your phone, click on that QR code. Be curious about your data. You've heard a lot from Fulani and Annalisa today, and share that data beyond your NICU, beyond where you're at right now. Share it with your team. It's really important to highlight, share, and move forward. And we're here every step of the way. So thank you for your time. And I'm going to pass it back to Fulani.
Thank you, Courtney. That was a lot of information, and I'm sure very valuable to our members. So thank you so much for going through all of that. Next slide. Okay, so we're going to go through our Q&A section before we go to closing. Lots of activity already happening with the Q&A, but we'll also allow for some of you who still have questions to go ahead and put them in, and then we'll answer them as soon as we can. Okay, I know that there's a lot of questions about EDS. So thank you, Annalisa, for sharing that link and all the other links throughout the webinar as well. While you guys are thinking of more questions, I just want to thank all of our panelists. Thank you, Annalisa, Courtney, and Jochen for all of your presentations today. And I will also want to thank Marcy behind the scenes, who's running our slides. Okay. All right. All right, so I don't see anything coming in. While I wait, why don't we just go into the closing slides? Okay, so thank you all again for joining us. Once you've logged off from the webinar, you'll see a page with the survey link for today's event. It'll pop up as soon as you log off, and then we can also put that in the chat for you as well. And we're really looking for your feedback, so please give us your feedback for that survey. CUs will be sent out at the end of all the sessions for the live session attendees only, and we'll be sharing all recordings and materials at the end of the sessions as well. Next slide. So our next session is coming up on Wednesday, October 16th. It's about NICU transports, which will be presented by our CPETS team. So we look forward to having you with us again for that. For CPETS, NICU and HRIF webinars that are coming up, we recommend that you have access to all of these, your NICU data, your NICU reports, HRIF, just to really optimize, your participation and the time that you're spending with us. So if you need help logging into any of those platforms, please send us a message at the help desk. All right, next slide. All right, so I'm going to look in the Q&A just to see if there's where can we view timelines? We will send that over in just a second, Janet. So thank you for asking that question. Just a second. Let me get a link for the timelines.
I sent it in the Q&A form.
Oh, you did? Okay, thank you so much.
We have a general timeline on our CPQCC.org website under the when in NICU data. And then every year at the end of the year, we will release our data finalization guidelines for the following year. So I linked the ones for this previous year. Data is all closed out now, but we will be letting you all know when those guidelines are out again. They will have specific dates, and that is also one of the first items of your data finalization closeout checklist, is to review those guidelines, and the closeout checklist will have those dates as well. So there's a lot of places. The last one that I can think of is when you log into NICU data, it will automatically tell you during our data finalization process when things are due, if you have upcoming deadlines. So that is another place that you can check as well in the startup message when you're logging into NICU data. Thank you.
Yes, thank you so much, Melissa. Appreciate that. Another question is, do you need our name for sign-in? Yes, please include your full name, your RN number if you want CEUs, and your email address as well.
In the post-webinar survey specifically, is that
Yes.
correct? Yes.
I'm assuming that's the question. Just says, do you need name for sign-in? But either way, if you're sign-in, if it's for the sign-in sheet for your group or the survey, yes, you do need your name. So thank you.
Perfect. I can put the post-webinar survey in the chat. And then once we close the webinar, you all should receive a pop-up web browser with the survey as well. And that's where you will be sharing that information. Judy, thank you.
Okay, any other questions? Lots of thank yous. Thank you too. We appreciate you joining us today, and we hope you have a great rest of your day. If you have any questions, please shoot us an email, or you can submit a help ticket and we'll get back to you as soon as we can. So bye everybody. Thanks again for joining, and thank you to all of our panelists as well. Have a good day.